Health Insurance Act, as many of you realise, is complex. It's an extraordinary piece of legislative contortion, and to be candid, until I got involved in all of this, I had not realised what a horrible piece of legislation it is.
The Medicare guidelines do not state anywhere that you have to justify a home visit. It says it nowhere. They crucified me on that. I only came out of my shell 5 or 6 weeks ago after reading an article that Anchita had written. I've been profoundly depressed. I was suicidal.
In the last 2 weeks, I've had probably about 5 phone calls from various doctors, colleagues, healthcare professionals, who basically literally were at the verge of suicidality, purely because they've either been contacted by APRA or had the friendly call from PSR. And I thought, okay, I did not harm any patients. I did see all the patients that I billed for, and I am not a rude.
It is not irrational that a group of doctors will assess the performance of other doctors, but there are no peer review standards, and there's nothing in the legislation which requires that the members of the panel should be engaged in the same practice area as the doctor whose work they're considering.
I achieved so much. I'm almost 10 years out, but no, I need to put food on the table, and I don't want to cave and say that I did something wrong when I haven't.
The strike rate of the PSR is very alarming. And in 0 cases, was the practitioner found not to have engaged in inappropriate practice by the committee. Now, when none of the cases have been exonerated by the committee, you've got to wonder how independent the committee actually is.
Hey, we don't have any policies and procedures. Hey, we don't have any statistical formula that we can actually share with you in the name of public interest to say why you are in the 99th percentile all of a sudden. We actually have no idea about why we are doing this.
As I gave women what they wanted, and the chair at the time said, "What do women want, David?" And I said, "Well, if you look at the surveys, they want a female doctor." And we got one. And 12 months later, she gets a Medicare audit for inappropriate billing, doing too many pap smears. This problem has not been resolved very well at all. That doctor quit.
How do you challenge the initial decision of the director, which has profound consequences for the doctor involved?
As I look around our profession today, I fear that our very proud tradition of our self-belief, our codes of conduct and honour and an ethical basis are under constant attack. That our system in Australia is amongst the best in the world, not because of the administration or the bureaucracy, but despite it. There is a significant malaise through our system. It's ludicrous that it takes Medicare a matter of seconds to inform a provider that they are no longer registered and so can no longer bill. Why render a bona fide doctor a quack because they've been late in registering?
So it is impacting care, and doctors in this country, over the years, I've noticed, are withdrawing care because they want to keep under the Medicare radar.
Now let's look at the numbers. This is horrifying. So suicide in chronic pain patients who aren't undertreated for pain is higher than an opioid death. 5,000 GPs, 20% of the top 20% were given letters. Dear doctor, you fit into the 97th percentile compared to your peers. 1 year later, it took 1 year, 27th of June, a letter was issued. In this process, it was not possible to identify all GPs working in palliative care or prescribing for palliative care reasons. It was also not possible to identify those GPs who have a specialist pain practice or who have specific oncology bias to their practice. Why wasn't that issued a month later? Do you know the society cost? Everyone was scared. No, I'm sorry, our practice doesn't allow prescribing. So I think perhaps the query I'd put back to you is, have we just breached human rights?
Then we come to billing. An item which is often used, a 160, which is for emergency and imminent care. There's only 18,582 in all of Australia in a year. So the average is 0.37 per GP. So if you do one, you're in the 99th centile.
Then I lodged a federal court case.
With people who actually are members of the PSR, what standards or peer review process do they go through for, first of all, appointment, and then what training do they undergo to learning different policies and procedures?
The answer that I got, which has been admitted into as evidence in our trial, is that we do not have any policies or procedures. We do not have any training. We do not have any consistency, as a matter of fact.
No one wins at the PSR. The reporting can often be vexatious, political, or indeed commercially inspired. There is no appeals process. Once it's nailed, it's dead and gone forever.
The problem in Australia is we have a matocracy instead of a meritocracy.
Nobody can help you but yourselves. And this is where the conversation needs to start trending towards, because the problems are very real. And they will hurt you at some stage. If not today, you will be affected directly or indirectly. That's a guarantee.
I have several examples where what she has said to and prosecuted GPs for has been refuted by the health department in writing. And I've spoken to the health department, they say, we're two different departments, we make the rules, we'll interpret it for you. Look, the PSR has said, yes, it's the health department, we do not, under any circumstances, do any MBS interpretation. Well, that's obviously a flagrant lie, because they do.
Absolutely. The arrangements that are made before it goes to a committee is determined by the director herself, in this case, and the practitioner under review. So, absolutely, you're right. And unfortunately, as we've heard, they're completely protected by the legislation.
And it's the legislation that's the problem.
I would say that although the statute doesn't provide it, the director is in substance making the decisions. And what General Counsel said is simply wrong. As a practical matter, what she decides seems to dictate the outcome, and it has immediate consequences for the doctor involved, and that is why, in my view, the decisions of the director attract the obligation of affording natural justice.
We pay a lot of money to all these organisations so they can crucify us.
Why does AHPRA and the board hate me? They don't. In almost all cases, and there will be exceptions to this, but in almost all cases, they don't. They probably don't care about you at all. That's the problem. It actually entirely lacks humanity. If you are notified to AHPRA, you are just a number to them. You are on a spreadsheet. They do not care about you as a person at all. We all know that they spend far too long, they investigate too many people, they cause a lot of harm. It's all about KPIs for them. So all they care about is how many have we got in, how quickly did we deal with them, how quickly did we close them. They don't care at all about quality. They would rather have a bad decision in 60 days than a good one in 70 days. Now that, to me, is an alarming approach to regulation.
I've been in awe watching the intensity of this presentation today.
I mean, by me speaking now, I've signed my death warrant in terms of working for the government again, which is fine.
You are all Avengers today, because we're starting. We're starting to sort of go, no, enough is enough. Yes, we're going to complain. We're not scared. We're going to go, okay, we're going to do something about this.
It's really important that you get that support and you get people around you who understand what you're going through.
My impression of the Health Insurance Act is that the director and the committees act like bullies, just like AHPRA does.
You can't talk to a board member, you can't talk to your decision maker. So if you've got some really specialised field of surgery and you get complaints from a colleague in that field where there's only a handful of practitioners, you can be prepared to be in the system for years and years. Some people have conditions on their registration for 8, 9, 10 years. And the intent of conditions is not to be there forever, but the way that AHPRA and the board deal with it is they may say, all right, you're not allowed to practice in this area until the board considers that you're safe to do so. And then they provide no guidance or assistance in relation to what is safe to do so. So practitioners end up with these conditions on their public registration for years, which severely hampers their ability to work and obviously damages their professional reputation. The decision-making at board meeting is by gut. It's not through any reasoned process. They don't make any findings of fact. They don't consider what the law is. They don't consider any standard. It's essentially flip of the coin. I've seen decisions where the entire committee will defer to one practitioner because that practitioner knows the area better, and the practitioner will and ah and go, and you just sit there and they nod their head back and forth and they'll say, yeah, conditions. And that is the process. As a lawyer, I died inside when I was at some of those meetings.
What has this got to do with anything?
This case that Anchita has could actually blow a hole in the way the PSR operates.
I just spoke to the media just last week. They were completely disinterested in your views. They were extremely interested, and this is where we need to help the media, in real life patient stories.